Depression is the leading cause of disability across the world. In the United States alone, nearly 10% of adults struggle with it. But unlike something physical like high cholesterol, depression can be much harder to understand. One reason people often confuse feeling depressed with having depression. Almost everyone feels down sometimes. Maybe you got a bad grade, lost your job, had an argument, or maybe it's just a gloomy rainy day. Sadness can show up for all kinds of reasons, and sometimes for no reason at all. But then things shift and those feelings fade away. Clinical depression, though, is different. It's a medical condition and it doesn't just disappear because you want it to. It lingers for at least 2 weeks in a row and it deeply affects your ability to work, to enjoy life, even to love. Depression shows up in many ways. You might feel down all the time, lose interest in things you once enjoyed, eat too much or too little, struggle with sleep too much or not enough, feel worthless or overwhelmed by guilt, have trouble concentrating, feel agitated or slow and tired, or even have recurring thoughts of suicide. If you are experiencing 5 or more of these symptoms, psychiatrists would call it depression. And it's not just about behavior. Depression causes physical changes in the brain too. We can see them with scans that show smaller frontal lobes and reduced volume in the hippocampus. Zoom in closer, and you'll find issues with neurotransmitters like serotonin, norepinephrine, and dopamine. It also affects sleep rhythms and throws off hormone levels, especially cortisol and thyroid hormones. But even today, scientists still don't fully understand what causes it. It likely involves a complex mix of genetics and life experiences. And sadly, we don't yet have a test that can predict when or where it will appear. Because depression is invisible, many people who look fine are actually suffering in silence. On average, someone with a mental illness waits more than 10 years before asking for help. But the good news is there are effective treatments. Therapy and medication can work together to help reset brain chemistry. In severe cases, electroconvulsive therapy, a controlled seizure in the brain, can be life-saving. Other promising treatments like transcranial magnetic stimulation are also being explored. So if someone you know is struggling, gently encourage them to seek help. You could even offer practical support like looking up therapists nearby or writing down questions to ask a doctor. To someone with depression, even those small steps can feel overwhelming. If they feel ashamed or guilty, remind them depression is a medical condition, just like asthma or diabetes. It's not a weakness, and it's not something they can just snap out of. If you never experience depression yourself, avoid saying things like, I felt down too, or just cheer up. That can make someone feel worse, like their pain isn't valid. Just talking about depression openly and honestly can help. In fact, research shows that asking someone if they've had suicidal thoughts can actually lower their risk of suicide. The more we talk, the more we break the stigma and make it easier for people to ask for help. And as more people seek treatment, science gets better at understanding depression and developing ways to treat it.